Malo lava le soifua maua ma langi mama I e o lo tangtanga I mai ne tū la o lo ingoa Colin o te sau mai a whenga ma whangali I upolu. I le tausanga fau o le auwai lo tausanga muli muli I le pepa whaafua mai I le Universite a Aukilani. Talofa lava, my name is Colin. I'm from the villages of Awhenga and Whangalii in Samoa, and next year will be my final year in the Bachelor's of Medicine and Surgery. I chose to study at the University of Auckland because firstly, the amazing support they provide Pacific students, and secondly, the Pacific academics. I'm most passionate about learning new things and teaching, and that's because in the field of medicine, you're always learning new ways to improve your practice, new methods that will help patients better, as well as you're always teaching doctors that come and work under you, juniors. And lastly, I would say I'm most passionate about Samoan oratory. And that's because over the years of being in medicine, I've learnt the importance and the impact of having your language with you through your practice. What inspired me to study medicine, firstly, is my mum and my auntie. And the reason why they inspired me to do medicine is because in Samoan culture, service or serving others is a very important value. And to me, my auntie and mother exemplified these values. And so those values are also something very important in medicine. The second thing I would say inspired me to do medicine is a Year 11 assignment in high school when I first started learning about health inequities, and I wrote a report on type 2 diabetes. Learning about the need for more Pacific in healthcare to help our Pacific people is what really pushed me to pursue medicine. The biggest highlight of my studies so far have been clinical placement. Firstly, because you get to see the applicability and the value of what you learn in a real life situation, and the moments you share with patients, big or small, become major motivating factors throughout your studies. My favorite thing about being a student at FMHS is the amazing support you get from Pacific staff and other Pacific students throughout your studies. MAPAS is a great support program for Māori and Pacific students, and you meet other like-minded Māori and Pacific students who are there to work with you to reach your goal. So I like to think I'm quite privileged in the sense that I grew up exposed to my culture and my native tongue. And so the way I want to make a difference is I want to utilize that privilege to connect with Pacific patients and Samoan patients better, and therefore provide better quality care. And secondly, my long-term goal is that after all my training and after gaining all the skills I need in New Zealand, I want to return back to Samoa, back to my home, and work in the healthcare system there and hopefully change something for the better. There's a Samoan proverb that goes, "E fo le ala mea, le ala mea," and the direct translation of that proverb is about a thorn starfish is the remedy for the injuries of that thorn starfish. And the metaphorical meaning behind it is that the solutions to the issues within our communities is found within our communities. And so all the problems that we face as Pacific people in healthcare, the solutions to those problems lies within our community and our people.